What's up? How y'all doing? I know I haven't made a video in a while. Last video I made was about me being pregnant, I'm pretty sure. Um, I know y'all see I got the bonnet on, so obviously it's like one of them days, or been one of them past few weeks, because I've been too busy to do anything to my hair. But that's because I'm pretty sure I told y'all I started nursing school and everything, and it's just been a lot going on with classes, kids, my husband, um, having to move again. It's crazy. So, but right now I'm about 30 weeks. So uh, what these kids doing? No worries, she whines like that sometimes. Okay, look at that. Mm-hmm. You gonna show them some movement? She moves around. Sometimes you can see her. Yeah, that belly has gotten really big. Woo! 30 weeks, so what is 30 weeks? Let's see what 30 weeks is. 30 weeks. I'm 7.5 months pregnant at 30 weeks. Yes, I still have the spits, but not as much anymore. And I got this new thing where I like to chew a sponge and it's soothing. That's weird. I think they call it pica. But some pregnant women do get that, so I've been experiencing that. Um, Pregnancy brain has been making classes a little bit more difficult than they should be, but I've been passing. I got a BA chemistry. Whoop, 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 whoop. Darn train. One downfall to where we moved at. We're near train tracks, which we were near train tracks before, but this space is so open. The area is so open, I think it's just easier for the sound of the horn to travel, and it's loud. Yeah. So pretty soon I'm going to be taking some pictures. I need my pregnancy pictures done because I've never done that, just taking pregnancy pictures or whatever, being proud of my pregnancy, so I want to do that. And I've been getting everything together. I got my birth plan together. I'll probably talk about that too. Some of the things I'll be um, requesting during my birth, during my delivery of the new baby. And I keep saying the new baby girl, but I have not revealed her name to everybody just yet. So only a few people know what her name is going to be. But pretty soon we'll be announcing the name. It's not no big secret, but it's like, it's kind of like between me and my husband right now, I think. I don't know. But some of the things that I've said that I'm requesting on my birth plan, of course, you all know already that I'm a VBAC. That's a vaginal birth by cesarean, vaginal birth after a cesarean. So I'm a VBAC. I've already had a successful VBAC, and I'm having another one. I plan on having my husband there, my nephew, a friend of mine, and my doula, as well as my kids there when I give birth. During labor, I would like to have some music being played, some soft relaxation, 90s music or hip hop, or some African drums, the Lion King or something in the background to help me relax. I would like the lights dim. Firstly, because it's more relaxing. lately I've preferred dimmer lights. Anyway, it just helps me mellow out, but also it's good for the baby to come out in dimmer light because the baby is already in darkness inside the womb. And it's kind of shocking to the baby. Is another word I'm looking for. It's kind of shocking to the baby um, and everything to come out in those bright fluorescent lights, whatever they have in the hospital, LED lights, whatever. And also the light lamp they put the babies under is not exactly the best thing either. I forget what the name of those bulbs are. But yeah, I would like the lights dim. I would like quiet, but I also would like quiet, but I know my kids are going to make noise, but I would enjoy that kind of noise, just to have them around, um, and letting them know that mommy having a baby is completely normal. So there will be noise, but I would like it to not be like crazy or anything like that, with doctors running in and out and stuff like that. So, of course, as few vaginal exams as possible that can cause infection and everything like that. So I rather, and then also I'm going more natural. So, if I don't need a vaginal exam at the moment, I wouldn't want one. And I don't want any students or resident interns present. Um, I had a student in the room with my daughter. I really don't mind the student being in the room, but then sometimes I just want to have a good delivery experience without dealing with somebody else trying to learn. And I have no problem with another student coming in there and learning because I have to learn. So, but I just want the most, um, the best experience possible. And I think that without students is basically how I get that. I want to wear my own clothes, but I'm not like down on wearing hospital clothes, but I just want to look nice in my own clothes. I'm going to probably buy a dress soon to wear in labor, and be able to get into the water with and whatnot. Um, you notice I'm getting out of breath just talking. So, um, so yeah, I would like to wear my own clothes. Um, I want my partner to film and take pictures and be present the entire time for whatever happens. I want him to be able to record the entire experience and everything. He didn't get to with my last baby. Record everything because uh, first the hospital was really strict and didn't want us to record the delivery. It's not the full thing. And then batteries died and whatnot, so it was just a lot going on. Of course, to stay hydrated with clear liquids, and I would like to eat. They're telling me I can't eat because I'm a VBAC, but in my more modern um, birth and delivery science, it's okay to eat. So I'm probably going to be eating regardless of what they say or not. I mean, they can't stop me from eating if I eat what they're going to do, put me out the hospital. But I won't be eating anything like, they won't have to worry about me eating anything like bacon or chicken or something that's just really, really hard to digest. I'll probably be only doing fruits and smoothies and stuff like that, which is what I eat anyway. Salads, things that are easy to digest and that will keep my energy up during labor and during the pushing process. Because part of the reason why some women have C-sections and be too wore out to push or whatever is because, or even have complications because they're not allowed to eat. And they're not getting any nutrients, which isn't giving them any energy. And they can burn out just from not having energy from food during the labor, especially if you're in labor for a long time, like 19 hours or something. So, I definitely don't want to eat anything that can harm the baby, prohibit labor or stall labor, or anything that can cause like constipation, diarrhea, nothing like that. So just like simple fruits and stuff is probably what I'll eat. The heartburn has been getting better, but when I get it, it's still like, whoa. So, whew. I like to spend the first stages of labor basically doing anything to relieve myself and relax myself. So standing up, lying down, walking around, in the shower, in the bathtub. I plan on laboring in water. I can't deliver in water as previously stated in another video, but I can labor in water. I will probably get in the shower if that helps. I'm not interested in any kind of enema or shaving of my pubic hair. I don't want a catheter. And I don't want an IV, but I have to be constantly, I have to have a constant IV and fetal monitoring because of my VBAC, which is the next topic, fetal monitoring. I would like it intermittent, but I think it has to be continuous because I am a VBAC. And of course, for the monitoring to be external and not internal, and only if the baby is in distress. But those are just my requests. I think the hospital policy and state policy might be for me to be on continuous monitoring. Any augmentations I may get, if anything, I would have my membrane stripped again. But I don't know if I really want that because my water just broke before I went into labor. And it wasn't a bad experience, but it just kind of made things more complicated. Or, I want labor to go how it goes. I want to be delivered by the 26th. So, if anything, if my labor goes past like September 25th, I may see about some kind of induction. But the only type of induction I would like to do is the membrane stripping, not any Pitocin or anything like that. So, and then for pain relief, I want to try everything: acupressure, breathing, cold therapy, hot therapy, distractions, massage, singing. Singing helps me feel relaxed and everything, so I'll probably do that. And like I said, listening to music, meditation, or anything else that I may request at the time to help me ease the pain. The laughing gas is something I would try at the last minute, like not the last minute, but as a last resort. Like if the pain just becomes too bearable or whatever. But I don't want an epidural, so no epidural. But I am open to the nitrous oxide in the event that the pain is too unbearable and I can't focus through the pain and I can't breathe through the pain, and I'm not in the event that I can't handle it or whatever. But I know I'm preparing my mind for the pain and everything, so I'm not trying to go in with any unrealistic expectations about the pain. I know what labor pain feels like, so I just, I want to try positions like, of course, standing, leaning, walking, slow dancing, lunging, sitting, rocking, hands on knees, side laying, squatting, dangle, and of course, like I said, the tub in the shower. Also, some essential oils. I'm going to probably try rose, clary sage, jasmine, lavender, lang lang, rosemary, basil, clove. I'll probably burn them and also have them use them as massage oils during labor. And then during delivery, I would like to squat, lie on my side. I would like to do anything besides lay on my back, directly on my back and push. But I would like to be in an upward motion when I push the baby out. So squatting, even lying on my side if I need to, if that's the best position to push the baby out in or the easiest. Be on my hands and knees, standing, leaning on my partner. Use people for leg support, my doula, my partner. Use foot pedestals. Use a birth bar and a birth ball. Be in the, I can't be in the tub during delivery. But, so, but, I need to buy a birth ball or exercise ball, whatever you call it. As the baby is delivered, I would like to push spontaneously, as directed, push without time limits, as long as the baby and I are not at risk. I don't want just because the labor is taking a long time and I'm taking a long time to push or whatever, that it just put me out immediately into a C-section. I had to happen with my son. I feel like I wasn't given enough time to push no more than 30 minutes. Um, I don't want any forceps or any vacuum extraction. And I also want my husband to catch the baby with the assistance of the midwife as well. My husband wants to be there to catch the baby and, he wants to be as part of it as possible, as active. He wants to be very hands-on. That's my husband. And I would not I don't want any episiotomy, even if it means I'm at risk of tear. But I find that an episiotomy increases the risk for tear because it's already slit. It's just like if a towel already has a slit in it and you pull it, it's going to automatically, or if you're pushing something through a hole that already has a crack, the hole might split, so that's just my mind about it. Immediately after delivery, of course I want my partner to cut the cord, but only after it stops pulsating and pumping nutrients to the baby. So I wanted to stay attached for a couple minutes, which this hospital is very good at. And these midwives are very good at. I don't want any Pitocin, and I want to keep my placenta to encapsulate it and take it probably as pills. Maybe I'll cook it like a steak. But no, to make it last longer, and even to possibly give it to my kids, my boyfriend, whatever. It's a good vitamin once encapsulated and dried. So I plan on drying and encapsulating my placenta. I may do it myself. I may pay somebody to do it, but it would be fun to do it myself. I don't plan on having a C-section, but if one is necessary, of course, a second opinion, and to stay as conscious as possible for my husband to be with me, to see it, to see what's going on, in the mirror, hands to be left free, surgery to be explained as it happens. I want that, Of course, I would want an epidural if I end up getting a C-section, but I that's not going to happen. I would like to hold the baby immediately after delivery before the eye drops are given. As soon as possible after delivery, before eye drops are given. I would like to breastfeed, ASAP, as soon as possible. And I want my husband, Nick Kiddit, and Elijah and Taraya to join me immediately after. I would like my family to join me immediately after. And I would like to see any medical exams or procedures being given to the baby, whether it be shots, hearing screenings. I don't plan on letting the baby get any shots, but, whatever they plan on doing, the eyes, exams, or whatever. And given in my partner's presence, please don't, I don't want my baby to have sugar water, formula, or pacifier. Or I don't want the vitamin K or the antibiotic eye treatment. Well, I may let them get that. Let the baby get that. The eye treatment or whatever. If need be. Shouldn't be any problems. But, I don't really want anything extra for my baby. If I test positive for like GPS or whatever, I'll probably do the eye ointment. I like the baby's first bath to be given by me and my partner. I like to feed the baby only breast milk on demand, on schedule, with the help of a lactation specialist. I like to stay in my room. I like the baby to stay in my room. And I like my partner to have unlimited visits and sleep in my room. If we have a boy, of course, no circumcision if we had a boy, but we're not having a boy, so I don't have that to worry about. So happy. But no, we wouldn't have gotten a circumcision. if it was a boy. My husband already agreed to that. So, as needed post delivery. Yeah, for other people out there having a boy, you should strongly do research on circumcision. It's not necessary. I regret getting it done on my son. I didn't know better back then, but it's not necessary to do. You're cutting off a part of your child's penis. So imagine if your daughter's clitoris was cut, shaved, female circumcision, So why would a natural part of the child's penis need to be cut? Just think about that. And it prohibits penis growth, or at least, stunts the growth, and it decreases the pleasure of sex. Again, when older, I mean, you still have pleasure, but apparently there's bigger pleasure you can have if you're not if you're not circumcised. So just do your research. Even if the father is circumcised, have him do his research so he can learn and make a better choice for his child to not have the child circumcised. If the baby is not well, my partner and I will accompany the baby to the NICU or another facility. I want to provide I want to breastfeed or provide pump milk into hold whenever possible. That's if anything is wrong with the baby. So that's it on my birth plan. If there are any questions about my birth plan, please leave it in the comments below. Or any questions about what I'm going to be doing as far as my delivery, as far as nursing school, whatever. Speaking of nursing school, I applied for clinicals this next semester, and I know I'm having a baby, y'all, and I probably should have delayed it, but I kind of don't want to delay it, so I'm just waiting to hear back about my acceptance. I already got approved for eligibility, but now I'm just waiting on full acceptance, which is going to be in a few days when I find out. So, I'm like, okay. I hope I get in, but I may still delay it because I'd like maybe a little time with the baby. Depending on how classes are. I don't know. We'll see. But that's it for right now. Just been getting stuff, buying stuff for baby and everything. But alright, talk to y'all next time, and I will do it next time. I know I'm not that consistent with videos, but I'm not really, I guess, into taking videos and pictures as much as some people or whatever. Just not super into it. I like it, but I'm not like crazy about it. So that's probably why. And say goodbye to the baby. Woo! So, but I will be posting more videos.